the season. And so right now, speaking of kickoffs and a woman who couldn't care less about it, Stacy Flowers with Direct Primary Care Associates. Good morning, Stacy.
Good morning.
Now, say good morning to Zandra Welsh. She is filling in for Bridget. Bridget is back in rehab.
You shouldn't talk about Bridget like that.
It's not funny, Stacy, to laugh at
Stacy.
Her problem.
Good morning.
Good morning.
All right, Stacy, what would you like to talk about some more? What's happening?
Well, new studies show that health habits as children and teens can significantly impact our health as adults. So they looked at 5 different risk factors: BMI, body mass index, your systolic blood pressure, so that's that top number, your total cholesterol, triglyceride levels, and whether or not there was a smoking history. And they found that abnormalities in any of these risk factors almost tripled the risk for cardiovascular disease in adulthood, with the number one risk factor being whether or not the child smoked or was exposed to secondhand smoke, followed by BMI, that top number on the blood pressure, the systolic, and then triglycerides and cholesterol. And so even if all of the risk factors were not present, the risk was increased even if some of those were noted. Those with elevated blood pressures, even mild elevations, had at least a double risk for cardiovascular disease. So some steps that we can take to make sure that our children are getting on that right course for health in adulthood is knowing our child's risk, knowing their weight, their blood pressure, having that cholesterol panel checked, which is usually done in adolescence, but can be done earlier if there are risk factors present. And talking to our kids about smoking. Regular routine checkups where these things are being screened are very important. And if your child does have risk factors, then getting them in with their doctor on a more regular basis, more than just that once a year. Here at Direct Primary Care Associates, we do see children ages 2 and up. So for those individuals who don't have insurance through the government or don't have a commercial insurance plan or have that really high deductible plan, we are a really good fit for that. We're a membership-based primary care clinic, and so we do fit really well in that gap for individuals who either don't have insurance coverage or who have those really high deductibles.
Stacy Flowers, Direct Primary Care Associates. How can people get more information?
You can check us out at our website, directpca.com. You can find out all the information about all our services. They're included in our low monthly membership fee and all about our pricing model.
All right, Stacy, thanks so much. We'll talk to you tomorrow.
Thank you, sir.